Community Analysis of Gulfport, Florida by Kathleen Newton. Here's a presentation outline. So the creation of Gulfport began in the 1880s when Hamilton Diston purchased the land that is present-day Gulfport with plans of creating a city named after himself. Although he tried to build a thriving town, his plans for Diston City never came to fruition. Transportation to and from the area was difficult, and a planned railroad through Pinellas County bypassed the area. During this time, the town only had a small population. In the early 1900s, a trolley line was implemented between St. Petersburg and Diston City, and it was revived as a tourist destination. A new subdivision was started during this time by John Chase, and who renamed the area Veteran City. This development also failed to thrive, in part because of the lack of transportation. In 1910, the residents of Diston City decided to rename their city to better reflect its potential, and Gulfport was officially incorporated. The residents chose Gateway to the Gulf as the city's motto. As infrastructure in Pinellas County improved, Gulfport began to grow. Over the next few decades, Gulfport flourished. The Boca Ciega Yacht Club was founded, the Bayview Hotel was constructed, and the Gulfport Casino continued to be the center of social life in Gulfport. Gulfport did experience several periods of economic difficulty, but took advantage of the economic boom in the 1990s to revitalize the town. Today, Gulfport is known as an arts destination. Gulfport has a walkable downtown area with restaurants, bars, and tourist shops. There's one large grocery store, a Save-A-Lot, within Gulfport. All other local grocery or larger stores are too far to travel to on foot or bicycle, and residents must use either public transportation or their own car. While the rest of Pinellas County has implemented bike trails and lanes, Gulfport does not have many bike trails or safe bike lanes for its residents. There are several proposed trails, but they are not finished. Health clinics are also not easily accessible for those without access to transportation. The closest health clinics for low-income families are Community Health Centers of Pinellas, Inc. and the St. Petersburg Free Clinic. The closest hospitals are also located in St. Pete and include Palms of Pasadena, St. Anthony's, and Bayfront Hospital. Gulfport has a large senior population, many of whom live in town shores, a retirement community for those 55 and over. This complex is very large, with 19 buildings, 4 pools, 28 boat slips, and 11 shuffleboard courts. For low-income families who are facing homelessness, there are not services located directly in Gulfport, and these individuals must look for assistance from organizations in St. Petersburg. Gulfport has a much better walkability score than neighboring St. Petersburg. A walkability score is a measure of how much of a resident's daily life can be lived without use of transportation. Gulfport 64 is right between somewhat walkable and very walkable. This means that some or most errands can be carried out on foot. This is better than the St. Petersburg score, which is listed as car dependent. Gulfport has a significantly higher percentage of individuals over the age of 65 than both the U.S. and Florida's average. Gulfport is also not a racially diverse community, with 86% of its residents listed as white, compared to the national average of 77.7%. In this presentation, we'll be focusing on the senior citizens of Gulfport. Because Gulfport is a community with a high percentage of older adults, it is important to recognize what their particular health risks are. Adults over 65 are at risk for mental health issues like Alzheimer's and dementia, and physical problems like diabetes mellitus, congestive heart failure, and arthritis. In addition, as these individuals age, they may lose their ability to drive, need extra help around the house, and need additional means of socializing with their peers. Older adults need opportunities to socialize, which may be more difficult if they have limited transportation. In addition, it is important that seniors have access to medical professionals who specialize in geriatric care. Easy access to preventative care is important, as are support groups that may help seniors understand their own disease process and management better. Access to physical activity is also important, as is access to affordable housing and transportation. Gulfport has addressed many of the needs of its senior citizens. The Gulfport Multi-Purpose Senior Center provides free and low-cost health screening services, support groups, and educational classes. In addition, it offers fitness classes and has a fitness center. St. Vincent de Paul Society provides assistance with food and utility bills. The Neighborly Care Network and Gulfport Extended Minibus services offer free or inexpensive transportation. Gulfport has many opportunities for senior socializing at the Gulfport Casino and Catherine Hickman Theater. Town Shores is within walking distance of the downtown area and provides recreational opportunities for its residents. Local grocery stores and the Tuesday morning produce market provide food choices. So health resources, we've already discussed, for the population at large are scarce in Gulfport. There are no listed health clinics, private or nonprofit. There are some health-related resources for senior citizens, as we've already discussed. Affordable health clinics can only be reached by car or public transportation, and the same is true for local hospitals. So the three goals that I've chosen from Healthy People 2020 for Gulfport are the following. The first is increase the proportion of trips made by walking. It's already occurring in Gulfport. There are many neighborhood parks that are within walking distance to residential neighborhoods, and the downtown area, as we've said, is pedestrian friendly. Gulfport can improve this by adding more neighborhood convenience and grocery stores and repairing some of their sidewalks. The second goal, reduce the proportion of adults who engage in no leisure time activity, can also easily be addressed by the city. Where there are no gyms in the area, there is a senior center that can be open to the public for a small fee. The city could also sponsor walking, biking, or running clubs and to encourage residents to be active. As stated previously, Gulfport has numerous city parks that can also be used for exercise. The third goal is increase the proportion of older adults with one or more chronic health conditions who report confidence in managing their condition. It is also being addressed by the city. The Gulfport Senior Center offers support groups and classes on health management for senior Gulfport residents. So here's some information on the environment of Gulfport. The one I'm going to focus on is the park system at the bottom. Gulfport has an extensive park system with 9 parks for resident use. The parks range from small neighborhood parks to nature trails to fully equipped baseball and softball fields. The city of Gulfport has a total of 5 representatives, including the mayor. They pass legislation regarding the city. They hold council meetings the first Tuesday of each month. However, they tend to hold these meetings actually more frequently. Videos of council meetings are available on the City of Gulfport website, and the meetings are generally well attended. Residents are given an opportunity to speak. The City Council follows 4 principles in creating the budget: to give service to all residents, to focus on educational and community events, focus on effective government, and focus on the future. It is clear that these 4 principles were considered when creating the budget, with almost half of the budget going towards public safety and the second highest amount going towards public works. So here are my community diagnoses. The first is lack of access to food and other goods. While Gulfport is thriving, 16% of its population is living below the poverty line. As we said, there are a few large grocers in the area, and if a resident does not have private transportation, they must take a bus to the nearest Publix or Walmart. The solution would be to attempt to attract more small, affordable groceries and improve access to public transportation. The next goal is lack of available physical activities. While the senior center in Gulfport is thriving, as we've said, there's no gyms for the general population. So an attempt to attract more fitness centers to the area would be a solution. Complete the proposed bike pass with the city and create running or biking groups that encourage others to participate. There's no resources in Gulfport for the poor or homeless. So partner with local churches or civic groups to provide more food and utility assistance for families in need. Organize support systems for homeless individuals or families with transportation to and from shelters outside of Gulfport, and offer satellite offices for counseling and mental health services within Gulfport. For access to health care. Without a car or use of public transportation, it's virtually impossible to go to a clinic or other healthcare facility. As we've said, no clinics are located in Gulfport. So, a solution would be to partner with local agencies to open satellite offices in Gulfport, or schedule weekdays when representatives from these clinics can meet with residents at local community centers. 5 is the evacuation zone of Gulfport. It's located in evacuation zone A, meaning that a storm surge as little as 4 feet could flood parts of the city. The city does have a plan in place to mitigate the damage and evacuate residents, but they need to make sure that they have a plan for those residents who have no transportation. The last community diagnosis is the 49th Street corridor, which is known for being a high-crime area with many dilapidated structures. There are 29 key points to the plan the city has developed to address this, and they include ensure public safety, improve appearance, and enhance quality of life. So the global health problem, again, that relates back to Gulfport is not having access to health care. In the rest of the world, this affects 2.6 billion people. So there are a variety of factors that contribute to this: unavailability of healthcare staff and poor transportation. So the way Gulfport is addressing this problem is free or cheap transportation to residents 65 and older, and the senior center that provides health screenings. They don't have anything in place for the population under 65 and relies on Pinellas County and neighboring St. Pete to provide health care for residents. So actions for the public health nurse are included here. Here are my